Private practice radiologists can help guide the best practices for AI through closely working with their healthcare partners and healthcare systems. It's important to have radiologists in administrative roles and informatics roles that are sitting on AI steering committees and are always in the discussion with the radiology directors, chairs of AI deployment at the hospital systems. So it's a bit of a song and dance and a bit of a balancing act because there can be competing and overlapping interests. But you want the radiologists to stay in those conversations and maintain good, healthy working relationships with the varying committees. What a radiology practice should be looking at in terms of ROI, I think you can break it down into quantitative and qualitative factors. We're fortunate at RANT, we have a data science and analytics division, so we can look at before and after with a proof of concept, hard quantitative numbers, efficiency, productivity, whilst maintaining or even increasing quality. They should also think about the qualitative side, which is harder to measure, but it gets to factors like burnout, career longevity, and that's usually defined as decreasing the cognitive load or cognitive burden, right? Making the workday a little more pleasant through automating and outsourcing some of these mundane, repetitive tasks that we do. So I would encourage practices when they're thinking about ROI to evaluate them both quantitatively and qualitatively. It's able to simultaneously broadcast to everyone involved in care and get them coordinated on the same page at the same time. So it really just disintermediates a lot of the friction in the system, a lot of the in-between messaging, and gets the patient the care they need sooner. The way that it works is the technologists, as they acquire the images, Viz starts to analyze the information, concurrent with the technologist then doing reconstructions, sending images to PACS, DICOM routing to another PACS. So, at the same time that that's happening and that's incurring a time penalty, the patient is waiting for treatment. Concurrent with that, through the phone messaging app, the care team is notified. So you have the neurosurgeons, neurointerventionalists, neurologists, and they're able to then communicate amongst themselves, knowing that this is the positive imaging finding, and triage and then go to management. And this happens all sometimes before the radiologist has even seen the images because they haven't crossed over through the tubes of the internet, for lack of a better term, to our work list. For optimizing workflow, the combination of AI imaging and messaging is very important. It helps you find the needle in the haystack. A lot of exams get ordered and the overwhelming majority of them are negative. So it serves as a pre-triage and it'll bring the positive exams to the forefront. So this differs from just a generic label of stat in that it's identified that there's a positive finding and particularly or specifically an actionable positive finding. Radiology is an interesting crossroads right now. There's a radiologist shortage, which is just a microcosm of a larger physician shortage, which is a microcosm of demographics and many other factors. And burnout is very real in healthcare and in radiology in particular right now. The pressure's on, the turnaround times have never been longer, the volumes have never been higher. So for me, the primary ROI is how do I feel at the end of the day, right? Does this algorithm make me feel more stressed or less stressed? Has it made my workday more pleasant or less pleasant? There's definitely been an impact on patient outcomes because again, they're being seen sooner. And in the case of, say, stroke or cerebrovascular accident, that's viable tissue every second ticking away. Same thing with heart strain in the setting of pulmonary embolism. Just the impact on improved patient outcomes is going to have many downstream effects. Decreased length of hospital stay, less complications or potential comorbidities. So those economic outcomes in and of themselves are huge. I think that sensitivity is the most important thing right now, because it's really a law of volume and large numbers. And as you're attempting to make it through this large stack of cases, when at the end of the day, when you're tired, and you think an exam is negative and there's no PE, and the algorithm says it's negative as well, you have concordance. And in a high sensitivity environment where there's the number of false negatives is low and you both are calling this negative, that's very reassuring. You can move on to the next case. I think that is the biggest driver of value right now. More information does not necessarily lead to more truth. And so what sets Good AI apart is being able to deliver a clear signal that's easily interpreted and easily actionable by both the radiologist and other members of the healthcare team. It's really a win-win, right? Because it makes our lives easier, it improves patient care, helps care coordination, and is pleasing to the other members of the clinical team as well. Tomorrow will only be more digital than today, and I don't think you have to make the argument for the use case to radiologists anymore, right? We have these soul-crushing, endless lists and all this endless volume, and that's not necessarily a problem. The problem is that you're unable to handle that safely and efficiently, right? I don't want the volumes to decrease. I want the ability to handle those cases without sacrificing quality. So I'm very much looking forward to what the future has to bring. I'm in the lean in camp, and I know that it's actually a bright future. I would encourage someone to go into radiology.